take the muscle opposite of its action, which is going to be cervical side bending, rotation towards the muscle, and slight flexion. We want to go proximal to distal, so our proximal insertion will be on the upper part of the scapula. So our first contact is going to be on the distal aspect of the acromion so that we don't compromise the muscle with our hand contact, such as this. Our other hand contact will be on the occiput, but on the superior aspect so that we don't, again, touch the muscle here where it's coming in on its insertion. Proximal contact will be stretched first, so depress the shoulder with your hand. We're going to side bend away, slight flexion because we don't want to bring in all the cervical extensors with full flexion. And then now we're going to rotate towards the same muscle to get that upper trapezius stretch. Do you feel any symptoms with that? No. Okay, and you feel the stretch? Yes. Can you show me where? The MLT of the levator scapula is going to require us to take the muscle opposite of its action. And one of those actions is going to be downward rotation of the scapula. So the patient's position is going to need to be modified with shoulder flexion to get the upward rotation of the scapula. But first I want to show you the hand contact that we want to make on the upper edge of the scapula, which is going to be more on the medial aspect. We want to contact that with the MCP of the hand, like this, versus getting your web space in there and pressing with your web space to protect your CMC joint. We don't want you doing that. We want you to contact it with the MCP joint, such as this. So we need to bring the shoulder into full flexion. And if we can't get full flexion and it seems the patient is uncomfortable, we can add a cushion to make that easier on them. Come in with the hand contact on the superior aspect of the medial scapulae. Second contact is going to come in and purchase the occiput. Now I'm going to depress the shoulder to get the proximal stretch. Flex the cervical spine, side bend away fully, and now I'm going to rotate opposite of the muscle to get the lengthening. Do you feel any symptoms with that? Do you feel the stretch? Yes. And where? Come out nice and slow. To muscle length test the scalenes, we need to take that muscle opposite of its action, and we're going to focus primarily on side bend. We'll take the scalenes as a group here. First thing we need to do is find the first rib because that will be our proximal anchor. And you'll find that in this triangle between the clavicle and the anterior fibers of the upper trap. And the purchase should be found just anterior to the upper trap. It'll be a pencil-like structure in there. The contact on that with my hand will also be the MCP. Again, not the web space to protect your CMC. So it should look something of this sort. Nice and soft, sinking through the upper traps. And I will contact that first rib. If you need to side bend towards to get a better purchase, you can there. With this stretch, when you side bend the head, it is likely that you'll get more of a superficial skin stretch. So one of the best things to do is to start a little bit more outside of the rib and gather up that skin just like this, then sink in on the first rib. So that now I'm going to get a true length test of the scalenes versus the superficial skin. Other hand contact again is on the occiput. Sink in with my body weight on the first rib to anchor that down. Now I'm going to side bend away to lengthen the scalenes. Do you have any symptoms of that?
No.
Yes. It's on the way. To random muscle test the upper trapezius, we first want to assume the patient in an upright sitting position and appropriately draped. Passively, we will have to shrug the shoulder first and ask the patient to side bend their head to the same side and rotate and extend away as if they're looking up at a bird. So passively, now actively, can you shrug your shoulders and put those motions together for me? And now we know that patient has that motion. To test it with the maximal strength test, I will have to contact with one hand on the distal aspect of the acromion to make sure that I'm not compressing on the muscle. The other hand is going to go on the posterior aspect of the occiput. Ask the patient to shrug their shoulder and look up and away. And I'm going to apply resistance, and my commands are hold, don't let me move you. Apply force in opposite directions. and then relax. Slowly in, slowly out. She is going to be a 4+ out of 5 because you can tell. To manual muscle test the middle trapezius, we're going to have our patient in a prone position with a pillow supporting their thorax. The cervical spine can be resting on a towel or the patient's arm, your choice. But what we do want is that the patient's neck is turned towards the therapist so that we can observe their face during the test. The motion that we want to achieve, passively first, I will assess the arm going into horizontal abduction and then at a deduction, my apologies, and I want to make sure that the scapula is going into retraction as well. So can you perform this motion for me on your own with the thumb up towards the ceiling? Okay. Now I'm going to hold the test position. Stabilization is going to go on the opposite scapula. Other hand contact is on the distal arm. Now I want to remind my patient to breathe, and I'm going to ask her to hold and don't let me move. Don't let me move. Pressure is directed towards the floor, and remember to breathe. Hold on, let me move you. And test is in, gradual out. She broke. To manual muscle test the lower trapezius, again we have our patient in the prone position and neck supported. We'll rotate their head towards us so that we can see their facial expression during the test. This motion is similar to the mid trapezius, but now we want to follow the angle of the lower trapezius fibers with our force direction. So passively I will assess the patient if she can do this motion. Can you do this motion for me? Again, thumb up towards the ceiling. Good. Now she's going to maintain that position. I know she's a grade of 3. My stability hand is going to go on the opposite side, PSIS, to avoid any trunk rotation. My force direction is going to be to the floor on the distal aspect of the arm, and I'm going to say, remember to breathe for me and hold, don't let me move. Hold. And again, with about 15 to 20% of my force, she is a grade 3+. And again, be judicious with your force because it is a long lever arm.